actually saw someone else who had the procedure.
Yeah.
You know, and so he asked us
I mean, have you ever seen anybody for this?
No.
No? Because, you know, it's something that, you know, you're also behaving because it's not bleeding anything excessively, so that's always good. So what I'm doing here is just trying to mark off kind of where I can make it take off extra skin and not have it be taking off too much. Here. Make sure I'm not hurting you. Is this hurting?
No.
Is it at all?
A little bit.
Okay.
No.
That's
I'm okay.
I'm so sorry about that. No, that's not acceptable. Let me put some numbing here. I'm so sorry about that. See, when we do tumescence, the surface of the skin does not numb up well. It's really underneath. So that's why I have to put numbing on the surface here. I'm so sorry, I forgot. I got all excited and I forgot that the surface of your skin might not be fully numb. I apologize for that. Try not to be so noisy, Valerie. I splashed you? Oh.
Perfect.
Should have admitted that. Okay, anything sharp?
No. That's fine.
He must say, please let him make sure he tells me. I don't want him to not tell me, okay? Valerie, your job.
Okay, I'm okay.
I know you're okay, but I can definitely make that easier. It doesn't have to be like that.
Mm-hmm.
Underneath it should be okay right here. Once we cut through the surface of the skin. Sorry.
Mm-hmm.
Underneath the throat patch, can you hold it down? Right here. It's pretty thick here. It's all tumescent, that's why it's like this light color here. You're doing great. There's one little edge here that wants to ooze here, so can I figure out what I kind of try to find a little while I get my buzzer. It was over here on this side here. Pull this back here. Pull that up. That's not it. That's something. a little bit more. You okay here? Sure?
Mm-hmm.
Okay. Still okay?
Yeah.
Alright, you better not be telling me I don't believe him necessarily.
No, I'm okay.
Pulling it like a trap door kind of thing. You okay here? Sure?
Mm-hmm. Yeah.
Okay. You're still okay. This is all the surface of your skin. So if you feel sharp, I want you to tell me. You can always add more. How many kids do you have?
None.
None!
No.
This was your kid. This was your baby. Is that your wife too, though? Yes, right? It's your wife?
Yeah.
Okay. You have a lot of relatives, though, huh? Why did he say no kids, huh?
¿No tiene
No, ella sí tiene, pero yo no.
Oh, la niña es de ella. Sí, ¿verdad?
Yeah, he's
La
good.
muchacha
Is
de
it
Sí,
right?
ajá, la que vino es de sí.
Anything that I need to buzz? No? I'm gonna close this here and then I'm gonna extend those lines here. Anything to buzz though? That's what I gotta double check here. There's something here, you think? Just wanna make sure there's no cloth forming anywhere. I don't think so at all. It's just something right here. There's a blood vessel right there, but I don't think I've affected it. Help me look. See. Is it too high for you? I don't think that it's down there. I thought it was on the edge here, like
Yeah.
here, right there.
Is there something pulling?
Nothing crazy, but sometimes I don't want to pull that up, like with your fingers underneath. Push it up. This one here, right here. Okay, pull it up with your underneath, like lift it up. So, yeah, okay. Wait, it's this one right here. This. Vessel underneath. And maybe I should tie it off or not. It stops. I won't have to. Come on. Just put a little tie in there just in case. It's so small, but I'll put a little tie in there. I'm gonna switch my gloves up later a little bit. Maybe you too. See if this is gonna tie anything off. No. So just a little tail on that. Get it? And we're gonna take, I'm gonna clean the gloves up once we get a few primary stitches in there. We're gonna switch up gloves. Let me just see how this pulls together here first. You might always still have redundant skin here, you know, and I'm trying to minimize the scar line but make it as least bumpy as possible.
Okay.
But obviously it's a pretty big area that we're trying to close here. I'm gonna straighten you up because I want to see how straight, so I don't do this crooked. We don't want it crooked. Should have drawn a straight line down him actually. That would have been useful in the beginning. Yeah, huh? Looks so small now. Two more, one on each side, and then we're going to break for a second. Remember to restart that thing too. I know, I forget.
Yeah, we're at 18, so I'm
good.
wondering if I should just.
Yeah, just stop it and then restart it again. Really, the time flew by. 18. Didn't seem like it was that long.
That's pretty quick.
Yeah.
Yeah?
Yeah.
One more stitch and then we're going to need a new stitch anyways, and then I'm going to need bigger sutures and stuff for this kind of stuff. Can you take this? You can put it on the tray if you want to. See right here, something wants to ooze, unless it's just collecting into the side. You know, because it's like the deeper side here. Do you need something?
Yeah, I just want to get that lap over there to put on.
Okay. Is that's the blackhead that I was looking at on the bottom of it. Remember that?
Mm-hmm.
That's all.
It's right there. Now when I do this, and I remember the sutures we use like in major surgery, abdominal surgery, I'm like thinking, God, you know, I could probably use getting some of those big old sutures, the ones that you hand tie though. But I'm gonna put a bunch of these little ones in, that give it nice strength. Gotta figure out what I'm gonna do at the end there. I'm not really sure how we're gonna the reason I'm talking like this is because the suture line, I'm trying to make it as short as possible, but you know, when you have something this large that really stretched your skin out, you have a lot of extra skin. This is the part where you could be creative and you try to figure out the best way to get all that extra skin off and have it lay flat. No, tuck that underneath there. You don't just put, you want to like really kind of, because there's something that might collect. Like sometimes put the gauze right underneath there. Just try to see if you can grab anything underneath there. It's okay. It doesn't look like it's wanting to bleed at all, which is great. But he's going to be having some pressure dressing, let me tell you. This is exactly the moment I think of. I need to start using drains. You know, you're familiar with drains, Valerie.
Yeah. Could change them for like a month for my sister. Actually,
they're not difficult. They're just like suction.
Yeah, you have to just pour it out into like the toilet and then.
And stitching in place, you just have to stitch so it doesn't get lost in there.
Yeah.
Just never really had to use them before. That's all. The longest part is the part now, we already took it out, like within, I don't know, 10, 50 minutes, right? We took it out. Now it's just taking a while to figure out how to close this up. That looks pretty good though. Just wondering whether, at least it can make it a smile and not a frown, right?
You thought it was a cyst, right?
Yeah.
I was like, it's a lipoma.
I think.
She said she got it out whole.
I feel like I need a trophy now to stand on today. A little trophy stand. There we go. That's nice on that side. This is gonna look good.
Yeah, it is.
Okay.
Where the heck? Let me see. Where did I put my suture? I got one side. Oh, here it is. You know what? Can you break for a second? I want two more things.
Sure.
You play. Alright, I took out a dog's ear on this side. A triangle. And we're making it a little, kind of like a trapdoor sort of a flap. At least that's what I'm calling it. And then this side, this side is let me just make sure there's nothing. Oh, it looks good. Not bleeding. So this side's a little bit bigger, and he's obviously lying on his side. So I'm just pushing you. Don't worry. I'm just pushing you just to see how this is when it's sitting up like this. Okay, let's try to get that. So let me do that. Here it is. So I'm gonna take another little line right here. Make sure I'm not hurting. Again, because the surface of the skin sometimes doesn't get that numb. But tumescence is fantastic. What I did before with the numbing, when I put the fluid and you got all wet. Oh, thank you. There's a little fluid trapped under there because it's in a very dependent position here. So let me just make sure we got all that out. Yeah. I know there was a little something I wanted to ooze there too. This is where blood could collect. So just try it one more time just to feel around. Good. Okay. So let's get to go a little bit longer here. Okay, I am going to, for just a minute, kind of turn you back again flat, like you were on your elbows for a moment.
Okay.
Do you mind? Thank you, sweetie. Watch this. That's great. Hold on, just like that, just for a moment. Let me just mark where we're going here. You're so good. Okay, you can come back now.
Okay, so
Okay. Okay. Gosh, he's like really, he's a pro, right? His wife was more worried than he was, I think. She said she was like, he needs a man. I think she's the one that needed the Ativan.
Yeah. A double doses.
A double doses. She's gonna hear this. I wish I could just call her now and tell her you're doing great. Well, I did tell her before that we thought it was a lipoma. I went out and told her once I saw it. So she maybe I'm not hurting, right?
No, no.
Okay. Don't make it go away. I can't see it then. Why we need a good pressure. I'm gonna squeeze the whole thing again one more time. I'm gonna use that one so that you can take that one away, okay? Okay, then put some suture right there. And then we're good. It's a little smile. Where's my 3L? Didn't you just give me a
it's behind
It's
the
behind
counter.
you. Yeah.
I think we need to put some water on it. It's gonna dry up. The lipoma he's got on that table.
Oh.
Just, it's okay if it dries up. It's gone.
No.
It's gonna be all sticky, yeah. Hold on, can you hold that for a second? There's a little piece of skin in it I need to trim. Yeah, be careful there. One more underneath. Maybe not one in the middle, but one more underneath on this side. You can leave your hand out and then just leave it tucked in. I want to get you like the sharp stuff there. Except for there's a big buzz.
Yeah.
Hey. Last shot to take anything that collects underneath there. So just make sure we put pressure on there. It is a U, a slight U shape, a little bit like a smile. We're leaving you with a smile. At least it leaves you with a smile, I guess, is more what we say. And your lipoma leaves you with a smile. The most important is that middle is the highest stress, so if I put another one in the middle, I'll just feel better. I'm going to do that right now. And then we're good. that was fun, but I wouldn't want to do this every day. I'll tell you, we get some very interesting things that come into our doors these days too. Most of them I don't say yes to. Most of those big ones at least, huh? Actually, do I say yes to most things though?
Yeah.
I do?
Like a
Are
challenge.
you guys like, why?
No, this one was really fun.
Yeah,
Cool,
I was
never
looking
know.
forward to this one.
Yeah.
I am very, very happy with it. Extremely happy with it. I'm putting interrupteds in. How far does he live? Kind of like a little longer, huh?
Yeah.
Like LA?
Yeah, it's like LA area.
Yeah, between like Glendale and Pasadena. Somewhere.
Oh, okay, not too bad. Like
No, no,
30,
it's
40 minutes
40
away.
minutes
Yeah,
with
okay.
no traffic.
Good. So you can come back and take sutures out. Oh, I'm not going to be here. You guys better take a lot of pictures for me. 10 days, huh?
Yeah.
10 days.
If I'm not here. I might be here. I might just be here.
It's 14, that's a Monday.
14 is a Monday? Okay, we'll make it 14. That's fine.
No, 10 days is the 14th?
The 10 days is the 14th. I think I'm here the 14th is a Monday.
Yeah.
I think I'm back here, but I'm going to be, I don't know if I'm seeing patients that day.
No, because yeah. we're
Right,
back on
Monday.
the
But I
Tuesday-
want to make sure, maybe he can come back the next day.
on the 15th.
That'll be 11th days, right?
Yeah.
Yeah, let's make it 15. I want to see him. We're almost done now. This is the end.
Okay.
The very end, yeah. Make sure that bottom part. We're putting in interrupted sutures that we're going to take out and on next Tuesday. Not this Tuesday, but the next one. This is why I don't do facelifts and stuff anymore, because I get so tired of putting in little top stitches at the end. I'm always like, I'm done. Somebody else needs to take over. This is why you need a resident or somebody that trains with you and they just do that part for you.
Christine, I could stitch.
Yeah, I know. I'm good.
We've been collecting sutures.
You have? Oh, you want to do it again?
Yeah.
Let's do it. We'll do it
It was
again.
really exciting.
We'll do it again for sure. Your stomach.
I know, I'm hungry.
This kind of things makes Valerie hungry. It's actually good. It means you're nice and relaxed now. We're gonna need that other suture. That's what crap. So what made you wait a long time to get this done? Because
I don't like doctors.
you don't like
I don't
doctors.
Yeah.
You don't like.
I don't like needles. I don't like all
You
that
did
stuff.
really well
Yeah,
though.
I know.
How come you did really well? Because you were then it became that
I
this was a bigger
thinking
deal.
It was something worse or terrible.
Ah,
I should have done it,
yeah,
a few years ago.
right.
Since
But then it gets out of control, and then you can't, and then
Yeah.
you it's still bad no matter what. You went to see other doctors, right?
I just went to. They take me like X-rays or something like. I believe like 2 years ago.
And what did
Because
they
I just,
say?
I just wanna
Have
see
you
that
done-
it's not rooted.
Make sure it's okay.
Yeah.
That's not something dangerous. Yeah.
But they tell me you have to take it out. This is not other way to do it.
Yeah, you have to take it out. Yeah. And you were afraid of general
Yeah.
anesthesia. I think
Yeah.
going under general anesthesia or something.
Well,
Did
not
you see
really-
other? Did you
No.
see other doctors for this?
No. Yes.
Just me?
Yeah.
And it's expensive. Insurance is not paying for it or anything like that, too, for you. So that was the thing, too, I think, huh? That it's
Yeah.
expensive.
I don't have any health insurance or anything
Yeah.
like that, so it's another thing that I.
Right. Worry about it
Yeah.
for all your family and stuff. But you did great. This wasn't too bad for you, huh? Just uncomfortable the way you have to lie down.
It's okay.
Okay. Tonight, I don't think you need anything other than Tylenol, really. I mean, you don't really, it's not, I know it's a bigger area, but I think if you put compression, it's much like we didn't go anywhere on muscle. When you go like to muscle is when you can, I think it hurts more. Yeah, this is okay. I think you just can have Tylenol, but do you have anything else at home, stronger?
No.
Probably no? Okay, I'll
have
talk to you about it.
Aspirin.
Okay, don't take aspirin.
Don't take aspirin.
Yes.
I know.
Okay, good. Because it can make you bleed more. This side might be a little bit bumpy, but I'd rather have it be bumpy than have to really, we'll see how, we can always take out a little bump if there's still a little bump here. I don't think it's going to be, but because it's just mainly the way you're lying. But let me take a look at you and see. Okay. All right, I'm gonna take a look at you here like this. It's a little bit of a bump here. Let me just trim that edge here. So we need to put a nice compression dressing on you here, okay? Because it will want to ooze underneath there, you know? We want to make sure it's nice and flat. So actually, I'm gonna have you guys. We're gonna take a picture. Like, let's take a little after picture right here first. Okay, I'm bringing it around.
Alright.
You ready?
Oh my God.
Look.
Wow.
It's like a brain. That reason is that I took a little punch, a little core.
Okay.
See the whole thing up popped up. It's
Wow.
very heavy. It's very heavy. Like if you were to hold it like this and pinch it.
Oh my God.
Yeah. We're gonna
It's
weigh
heavy.
it. It's
Yeah.
like a pound at least, I think. Right? I think it's all about. You haven't felt it, have you?
No.
Yeah, you want to feel it. Yeah, it looks really good, huh? It's just a little swollen, and we're gonna put a compressive band. Let me take a look at it again, sweetie. We're gonna put something to push it down, and it's just swollen. When it sits up, it'll sit down nice. Do you want to see the?
Yes.
You want to see it? It's big. Okay. Yeah,
No.
it's big. It's very heavy too. If you were to hold, like, lift it like this, feel it lift up, but not too much so it doesn't fall on the floor.
How much does it weigh?
It's heavy. I don't know. I'm gonna weigh it. Probably 1-2 pounds. Very heavy. The reason is like that is I took a piece from the top.
Oh.
That it doesn't. It wasn't. It looks like a brain almost.
Yeah. Hi.
Crazy, huh?
Can I take
So-
a picture?
Yeah, take a picture. I'm taking a picture right now. Absolutely, you can take a picture. We're going to weigh it. Just put it on the scale. Bring it up here.
Where was it from?
Upper back. Okay, watch out. Let me see the scale says. Wait, I don't want the zip code. A pound. Huh? 12 ounces. No. It's like only, not even, a pound is 16 ounces. 12.2.
Almost a pound.
Close.
You go to gym, you like do it because it won't interfere or anything, sleep better.
It's like a slight U shape, like a little smile. So, because it curves up.
Well, now you know.
She's like, I
That
have
is
to
way
hold it.
bigger than I
It's heavy.
thought. Okay, let me get my gloves.
There's some over there.
Right here.
Oh,
The pea gloves. Yeah, we're gonna weigh that thing, honey. Let's put a little tidy towel on that dental thing, and then like that scale. Can I put on the scale next to you?
Is that
Glaucoma? It's huge. Yeah, we can put a tidy towel on. You know what you could do is you could put them in these trays. Oh no, just make a tidy towel. Just put a tidy towel.
Put a tidy towel down.
Just put like a full tidy towel, and then we'll put that on top of it.
Okay.
Where was it?
Here, I'll show you the picture.
What is that worm looking one?
Don't drop it. Huh?
There's like a worm looking one. It looks like a pig.
That this is I don't know. It's pretty heavy, huh?
Yeah.
Yeah. You want me to take a picture with you for your mom?
Yes, please.
It was really amazing. I'm like really impressed. Oh my goodness, stop, Christopher. Let me just take a little piece for the biopsy. Yeah.
So, because you actually saw someone else who had
Yeah.
the procedure,
Yeah.
you know, and so he asked us
Yeah.
to
I mean,
come join
have you
him.
ever seen anybody for this?
No.
No? Blood trapped under here. Now the blood might already be, it might already be like jelly, you know, like what we call organized. It's called organized. We do that. So you shouldn't feel this, okay? And I'm just gonna put this underneath here. And I'm gonna see if I can pull anything out. See? There is some here. But can I pull it? I'm gonna get carpal tunnel here. Yep, see it's like jello a little bit. You okay?
Mm-hmm.
Yeah, there's blood in here. That's why. I'm grimacing because it's like suction. I'm trying to. Oh, there you go. Oh, look at that.
There it goes. That's good.
Mm-hmm.
That means that she didn't do a good job.
Oh, she did a great job.
Yeah, because you know what? He didn't want to cry when he was here, but then when he was home.
I was
happened?
crying
Oh,
day
did he?
and night.
He didn't cry here. He was a tough guy here. Now all the secrets come out, and we got it on tape.
No.
Look at that.
I
Made
said,
it
"Now
a
you
lot
want to be praying
smaller
in front
already.
of the doctors. Now you're crying with me."
I'm glad I got the 30.
Yeah, huh? That's so much fun.
Doesn't look as stiff now.
Mm-hmm. It's all soft now. There's still a little on the side. I don't know if I can get all that. Look at this.
Mira, todo lo que te sacó.
Oh my God. Really?
Yeah.
Oh, Jesus.
You can come feel it too. It's flat. It's flush flatter. Feel how this feels now.
Oh, much better.
Feel it too. Feel right here.
Ouch.
See what I mean?
Much better, huh?
Yeah, much better.
There still is some here.
Still some, yeah.
some jello here. So, and you know, we couldn't take out that much of the, otherwise I have to make this very long. So you might still have a little bit of a bump there, but I think it's definitely getting smaller than what it is here. Even from what it is right now, it'll get smaller. See, there's still more. See how dark it is? Because it's just all, there's a jello in there. So there you go. There should be, we'll put a little
There's
gauze here maybe to like
no way
soak
that
it.
he can get an infection because of that or having that blood in there.
No, I mean,
No.
there's always some risk, but
Yes.
it's a sterile environment underneath there. But I will give you like an antibiotic to just have just in case you want to take it, you know? Okay. So as we made one little opening, we did it like very sterile. We used all, you know, under like a sterile, clean, you know, syringe and everything. It still feels like that might be a little full here, but I can't really need anything out there. So I think this is more like jello here. Much better. Take a little picture of that. Full glory. Okay, ready? There's the area, right? Here, when we took a punch, a biopsy, okay? Being able to see it, right? You don't feel like lightheaded.
I don't know.
So
I'm
we-
fine.
Okay,
I don't know about hair.
Yeah.
Yeah, I said fine and then I'll be on the floor.
I
No,
don't
just
want you to
kidding.
do. See, now this is.
Oh my god.
Oh my God, you were able to take a whole
Mhm.
thing out.
So we know we got it all. Look at that.
Oh,
Thank God that this is
Brain.
from the left.
No, we don't have it yet, but I think I was on vacation too, so there's a little delay. But so let me check. I'll check, okay, and see. But I don't think it's anything to worry about. You know, it's a solid mass. It's been there for a while, but we'll always double check.
Mhm.
Actually, we sent it to the lab, so we sent the whole thing. Yeah. So then. It's when he set to the side. It's really good. I'm very happy for him here because it's still that hardness,
Yeah,
and it will soften up.
He has a question because over here it's still pretty hard.
Yes,
Wonder
it's all
what-
going to soften up. It takes months for that to
Really?
fully happen. Yeah, yeah. But it looks really good. Has it changed your life a lot?
Oh yeah.
Yeah, you probably really not able. Don't worry about. Don't worry about you wearing any certain clothes. You can wear all your clothes
All
now.
my clothes.
He's
Yeah.
probably spending a lot more money on clothes. A little bit. Turn a little bit this way. Yeah, then we can get it closer. Last time I saw this, but I didn't even think about it. We had other things to think
It
about.
was the other one. Most
Right.
important.
The other big pop.
Yeah.
But this one now I can concentrate on. Okay, hopefully it'll stay away though. Okay, I think that's good. Okay, very good.